Welcome back to News Channel 3 Midday. Each week at this time, we have a chance to check in with Santa Barbara County Public Health and get an update on the pandemic. Joining us today is Dr. Henning Ansorg. Thanks for making some time today, Doctor. Let's start with where we are right now. Things seem to be improving.
Yes, Joe, thank you. I would agree there. We are very optimistic at this point. Our case rates are going down continuously, not quite as quickly as I would like it to go. However, we are already below 10 cases per 100,000 population, which with the change in the landscape of the tiering system may really put us into the red tier in the very near future.
I guess that's my next question. So the red tier is kind of our next status update that we will receive. And the governor is making some changes that we anticipate here in the next week or so of once more people are vaccinated, the red tier will be easier to attain. Kind of explain that for folks and when we may see that happen.
Yeah, it's it's very nuanced, but what we saw in California is that certain areas with zip codes assigned to them have a lower healthy places index, or they are in a certain spectrum of healthy places index. And there is much more disease burden in those areas, meaning that more people compared to the other zip codes get COVID, need to be hospitalized and die. Therefore, vaccinating those people and putting a lot of effort into getting those people vaccinated will save the most lives in the shortest amount of time. So this is the goal in California, to get 2 million doses into the arms of people all across the state who live in these areas. And now those are 400 zip codes in California. And we're very close. Like yesterday was already 1.85 million. So
yeah,
we're not talking more. We're expecting this to be reached by tomorrow.
And then normally we would have to wait 2 weeks once we hit these health metrics, but that won't be the case anymore once these vaccines are out. Is that right?
Yes, almost right. It's the change that we have to wait for 2 weeks will be not so relevant. The reason for that, though, is that our numbers that we report always lag behind. So when we say we have 10 cases, that means 9 days ago that started. Yeah, I predict it's likely and very possible that we may hit this threshold as of next week.
That's great. This is certainly wonderful news. All right, let's talk vaccines now. We now have 3 vaccines in our arsenal to fight COVID. Santa Barbara County is vaccinating people as quickly as possible, I'm guessing. What is the update there?
Yes, we are really proud, even though it may sound like not enough vaccines, and that is true, but we have already administered about 110,000 doses into arms in Santa Barbara County alone. That's great. The third player now with vaccine produced by Johnson & Johnson is a great vaccine. I am really, really pleased to see this. It's very convenient, one shot and you're done. It does work. It protects against these nasty variants that have been around, like the England, the UK variant, and the South African, Brazilian variant. It works really well against those, and it has less side effects. So people who had an allergic reaction to the other vaccine can get this one without risking harm. So that's a lot of benefits. And I would say the more vaccines we have, the more the merrier, because you will always have the ideal person for one or the other vaccine for various reasons.
And then I know there's a lot of confusion sometimes about people trying to make an appointment to get a vaccine. If you go through your pharmacy, you got to go through them. If you're getting it through a county location, you have to go through the county. Can you kind of clear up some of the confusion for folks to make it a little easier where they can go to get one?
Yes, it is really confusing. I could not agree more. And the reason for that is that some pharmacies get vaccination allocations directly from the federal government. So we don't control them as the county health department. They follow the federal rules, and therefore the people who want to get their vaccine there, it's CVS, Walgreens, Rite Aid in our county. And then there are other pharmacies that get their vaccine doses actually from the public health department via the state health department. And those are Rolf's and Savon and other pharmacies. So you have to go to the individual pharmacy to find out. And then we have big groups like Cottage Hospital is doing a big vaccination effort. And you basically right now still have to sign on with them, with their registration platform. That will change as we speak. I think by tomorrow, it's like horrible. Things change so fast, you don't know where to stand anymore. So the answer is, I cannot give you a simple answer where to sign up. There are multiple versions, but you can always, always, always call 211 and you will get a live person, maybe not immediately, but you will, that will help you find a vaccination sign up for you. And that is through the Public Health Department. And there's also our webpage, publichealthsbc.org, where you can get information. But if you don't get further or you're not computer savvy, don't hesitate to call 211.
All right, a good resource for sure. And yeah, just try to make it easier for people and 211 is a good way to do that. They can help you out directly. Dr. Henning Ansorg from Santa Barbara County Public Health, thanks so much for joining us. We appreciate this time here at Midday.
Of course, my pleasure.